I have another interesting case for you guys, again, about being able to diagnose properly, diagnosis. And in this case here, this patient started to have pain associated with tooth number two. Okay, so it wouldn't, the pain would just not relent. She ended up having to take pain medication. Finally, she went and saw her dentist, and her dentist told her that everything looked good, and tooth number two could be the problem. Patient says she just cannot even touch the tooth with her finger or her tongue. Again, she's not complaining of any temperature sensitivity, just pain to touch associated with tooth number two. No recent dental work on the right side at all. And if you look at the bite wing of this tooth here, tooth number two is not even in occlusion. All right. So finally, patient was referred to us for examination, evaluation, and proper diagnosis of the problem. How to explain what this patient is going through. So figuring out what's going on. So I examined the tooth, percussion very tender, palpation on the palatal side within normal limits. On the buccal side, when I used a surgical operating microscope, okay, this is what I noticed. Look at that. That is a distal buccal parielis. And this area right here probed over 9 millimeters. Over 9 millimeters. I looked at the tooth, examined the tooth, didn't see any cracks. These are crease lines, but I did not see any cracks under a surgical operating microscope. The next thing I did was cold test. I cold tested the tooth, and patient raised her hand. Patient could feel the cold in this tooth, and that means that the pulp is vital. Okay. And looking at the radiograph here, you can see there are no periapical relucencies associated with tooth number two. So this was another example of a gingival abscess. Gingival abscess masquerading as a toothache and a tooth needing a root canal. But with proper diagnosis, we were able to figure out what the problem was. The problem is periodontal and not endodontic. So I recommended that the patient be referred to a periodontist. It's likely that because, again, this tooth does not have an opposing dentition, it's likely that the periodontist might just recommend extraction. I don't know. The patient didn't want to lose the tooth. The periodontist might be able to get rid of that gingival abscess and help patient maintain the tooth, but I don't know. I don't know about this tooth. Anyways, again, if I had done a root canal on this tooth, it would not have done this patient any good. So proper diagnosis is very important. Proper diagnosis.